The Big Whack presents Buffalo on the Rise, sponsored by Dr. Kaplansky Dental Implants. Get new permanent teeth in 24 hours with our exclusive Teeth Now process. Welcome to the television show devoted to local business, Buffalo on the Rise, with your host, Joe Chili. There's an entrepreneurial spirit in Western New York that's putting our area on the cusp of greatness. Each week, Buffalo on the Rise features local business leaders and decision makers who are shaping our future. If it's about local business, we'll talk about it right here, right now, during Buffalo on the Rise.
I'm Joe Chili. On this edition of the Big Wax Buffalo on the Rise, meet some great people and the stories about their hometown businesses, like Dr. Kaplansky, who shares his unique vision of giving you teeth now to make your smile bright. And Marie Klosko from Elder Transition Consulting, with great advice for you and your loved ones as they age. And Dr. Ronald Gefaller from SoftWave Buffalo, with a unique way to help get you rejuvenated. All on this edition of the Big Wax Buffalo on the Rise. Stay with us. I'm Joe Chili. You can listen to me mornings on the Big Wack. Joining us today on the Big Wax Buffalo on the Rise is Dr. Kaplansky. Doctor, I look at some of the certifications here. I look after your name and it looks like the alphabet, you know, with all the different things. Sure. But board certified in implant dentistry, diplomat of the American Board of Oral Implantology. What is it to be a diplomat? What does that exactly mean?
It was a lot of hard work, Joe, so to get to that point. Yes, absolutely. So to become a diplomat of the board, you have to not only perform thousands of implant surgeries, you have to take countless hours of continuing education, you have to pass a rigorous 3-hour written test, and you have to present 7 cases, I believe, your 7 surgeries to the board and defend them in front of people. So it's an oral exam that you have to take.
It's a little bit too much of an examination, I think, for me, but and I'm sure all of these things are costly as well. It's something that you have to prepare for.
I will tell you the most cost is the cost of what we would call being away from the family, being away from the office. That's where the most, because you have to attend these meetings, you have to go to classes, you have to travel a lot. But I have absolutely no regret. It was a fantastic process, and it gives you a sense of accomplishment that nothing else would.
And you have another family member that is probably going to go into dentistry, right, in school right now.
My son is a D3 in dental school in Buffalo, and I'm very proud of him.
Yeah, and that's something to be proud of, because not everybody wants to go into the family profession, if you will. You know, Doctor, there's so many different things and different firms and different kinds of individuals that are talking about dentistry, and national firms too. You know, when you see for me, when I see something come in like a national firm, I think of it in terms of, like, Buffalo is known for its hole-in-the-wall restaurants, right. The small restaurants that make it unique, you know what I mean? Yeah. Not the big national firms, you know, you can get those anywhere. And I kind of think it must be the same way with dentistry.
It's a great comparison. So the movement in dentistry is consolidation, so a lot of offices are very corporate right now. We have remained privately owned. It's my private business, and we are very proud of it. And it separates us from the rest because the quality of the work is higher, the attention to detail is better, and patients in general are happier because they see the same provider every time they come. They bond to us, we have a relationship with them, and they feel like family when they come in.
How many implant surgeries do you think you've done?
We do on average about between 800 and 1,000 implants every year.
Really?
Yes.
800 and 1,000. And these individuals come back to you so that you can check to make sure everything is going well?
Yes, we encourage patients to do that every 4 to 6 months. Absolutely.
What, to the average viewer right now, that is dealing with dentures or has dealt with dentures in the past, that has broken teeth, that have had an accident, that have gum disease or whatever it might be, what's their first step?
Very easy, just pick up the phone or send us an email from our website. And the first step usually is a consultation. They come in and they talk to our implant coordinator. We do either a 3D scan, that's a CAT scan, at no charge to the patient, or we take a panoramic x-ray, again, at no charge to the patient. And they get to sit down and talk with implant coordinator and me. Sometimes that consultation lasts for an hour or longer. And we spend all the time with them to pretty much explain all their options, go over what the process would be to do the treatment, and they leave with a very good knowledge and understanding of what to expect. But that's their first step, right? And then usually after the initial consultation, we schedule what's called a records appointment. That's when they come in and we take photographs, we take digital scans of their mouth, of their face. All that gets digitized in the computer, and then we use that to build up their digital sort of a case virtually, and then that goes into surgery.
And this is an evolving process that you're doing, right? The Teeth Now process isn't just something that's stoic, it's fluid, right?
No, absolutely. So the Teeth Now process means that they get their permanent, meaning non-removable teeth within 24 hours of a surgery. Then they go through the healing, and then they get their final or permanent appliance, usually about 5 months after the initial procedure. But they have fixed teeth throughout the entire time. So the process is evolving. There's constantly updates on digital technology out there, and we are right at the cutting edge of all new and digital technologies out there. So we incorporate them into our process constantly.
The other thing I have to say that is very impressive to me, not only all the certifications that you have, but when I look you up online, to see the positive testimonials from people, even down to the fact of saying that you're very affable, you're very nice, you're a great guy. I mean, when they talk about these things, it's more than just what you do professionally, it's how you treat them personally.
Thank you, Joe. It's really humbling to see how many of our patients say good things about us, and we work hard. It's not just me, it's the entire office, my entire team. So all my assistants and hygienists and office staff, we all work towards the same goal, and it is to make patients happy.
And if people are told they're not a candidate for implants, you can tell them maybe differently that they may still be a candidate, correct?
Absolutely. So there's still a small percentage that may not qualify, but most of the time we say, yes, you are a candidate.
Well, that's great. I mean, I think to me, it sounds like it's a simplified process. It is something, when I hear implants, kind of scares me a little bit, but your process seems to be something that I would be agreeable to. So I think that it's something that you've done very well, and I compliment you on that.
Thank you, sir. I appreciate it.
For more information and answers to your questions, contact Dentistry by Dr. Kaplansky by calling 716-772-7500 or go to drkaplansky.com. Promotional and sponsorship consideration provided by the following. I'm Joe Chili, mornings from 7 to 9 on Buffalo's oldie station, The Big Weck. Joining us on The Big Weck Buffalo on the Rise today is Marie Klosko, who's the owner of Elder Transition Consulting, right?
Yes.
Now first, welcome. Nice
Thank
to have
you.
Here. When you start talking about Elder Transition Consulting, I think it gives me, I think of all these lofty different things, but you're actually talking about people moving into a different space, kind of like downsizing, or, right?
Yes, it is downsizing, and we're supporting and guiding our local older adults and their families really through the transition of downsizing and moving and getting settled in.
Now, I've got to give you a lot of credit for doing this because, I've been in situations with my own family where you have to, talk about downsizing.
Yep.
It's not an easy conversation to have. I don't know, how do you do it? Isn't it kind of, difficult? Sometimes people, number one, don't want to move, don't want to give up my stuff. All this stuff is, these are memories. You can't take these things away. I'm sure you've heard all of this before, right?
We have heard it, and really what we do with our clients is, I think our best success has been when we have clients that have family members that are supporting them through the process.
Right.
So when there's family involved, like children or other people that are in their family or good friends, I think having that extra support system really does help them through the process, but we have clients that really are struggling and grieving through the process. So we try to work with them slowly and patiently and help them really make some decisions on the things that they want to keep, the items that they want to sell, and the items that they want to dispose of, a donation, and sometimes they just have plain old trash in their house that just needs to go.
You can't get rid of my dining room set. My dining room, this dining room set, I've had it forever. It's the size of a small car. Have you heard people, dining room sets, I think, to younger individuals, they're kind of like a thing of the past, right?
Correct. Most people that have dining room sets have a really tough time getting rid of them.
Yeah.
And we work with a local estate consignment company, and when I call them and say, I have a client that has a dining room set, usually it's like, it's going to be really tough to sell that, unless it's like a Kittinger, something that's a high-end, older model, older type or popular one from years ago that might be worth something, but generally speaking, people don't use or sell or buy dining room sets anymore.
All right, when you start downsizing, and there's the actual word, how do you start downsizing? How do you begin the whole process?
Well, usually with our clients, when we get ready, we usually start in an area that there's a lot of accumulation. So we'll start in a specific area like the basement or an attic, and a lot of times what we'll do is just sit our clients down and we'll start pulling things out for them, and we just work with them to start making some decisions. And a lot of times they can't make a decision and it's a maybe or I'm not sure, and we just put that aside. And usually what we'll do is go back with them again and see if they really want it. And sometimes they want to take it with them, and other times they're ready to let it go. But generally speaking, it is a slow process. I think our biggest successes with our clients are the ones where we actually have the time and they're being proactive about downsizing. The ones that are more difficult are the ones that the clients have had an emergency or they have to move quickly, and that just adds a whole other level of stress to them because they have to make decisions quickly, and sometimes it's not that easy.
Let me try to ask you this without being indelicate. What about someone that says, I want to make sure that this item is going to go to someone that's going to use it and not into a dumpster or trash heap? You know what I mean?
Yes. So what we try to do is work with our clients. Well, first of all, what we like to do is repurpose items. Mm-hmm. So usually when we say to a client, would you like to donate this? And they say yes. Many of them don't even care if they make any money off of it or monetize what they have. They would rather give it to somebody knowing that they're going to reuse it again. Right. So there's local organizations that will make a donation on behalf of the client. So like SoftWave Buffalo is one, where if a client has like old fabric, notions, yarn, we'll make a donation on their behalf, and clients are usually thrilled because they're willing. They know that it's going to a good cause. They know that it's being reused. They know that it's not going in the garbage. So anything that we can find a new home for, we try to do our very best.
And how do you know if something's valuable?
That's a good question. Usually what we do is work with a local estate consignment company, and we'll have them come in and work with the client to really help them understand if it's worth something or not. And they're pretty matter of fact. They'll say, yes, we think we can potentially sell that for you, or it's probably just going to be a donation.
It's kind of tough.
It is very hard.
It's a tough thing, and I'm sure it's hard for the individual that's downsizing themselves, but maybe sometimes for the family too, right?
Yes.
Do you ever end up being a mediator in between the two?
Yes, we do actually sometimes. When we're downsizing, we always tell our clients, make sure anything that you're not taking with you, you offer it up to a family member or a friend. And if they don't want to take it, then there's an opportunity to sell it or donate it or, take it with them, whatever they decide to do. But, it's funny because some clients are very good at making quick decisions about the things that they want to take and the things they're ready to leave behind. And other clients really have struggles with letting things go. And we try very hard to help them through the process. Again, we try to be very patient with the client and helping them through the process of downsizing.
Marie Klosko, owner of Elder Transition Consulting, thank you so much. We appreciate your insight.
Thank you.
For more information and answers to your questions, contact Elder Transition Consulting at 716-440-0933 or go to eldertransitionconsulting.com. Sponsorship and promotional consideration for the preceding segment was provided by Elder Transition Consulting. Hi, I'm Joe Chili, mornings from 7 to 9 on Buffalo's oldie station, the Big Wack. Joining us on the Big Wack's Buffalo on the Rise today is Dr. Ronald Gefaller from SoftWave Buffalo. How you doing?
Very good, thank you. Thank you for inviting me.
Oh, glad to have you here. Tell us about SoftWave therapy. This is really kind of a mystic thing to me, but I've heard of it before, but I'm not really sure what it is. So,
SoftWave therapy is something that's old and new. It's been around for over 25 years. So it's using technology that was originally designed for working on kidney stones, but they're using it for all sorts of new things now. It's using sound waves to go ahead and create physical changes inside the body. You're actually using sound waves to create changes as far as the body's ability to heal. You're increasing circulation into the body. You're reducing and modulating inflammation, so you can go ahead and reduce down pain for acute conditions and for chronic conditions.
now, when you start talking about sound waves, do they kind of vibrate in the body?
Actually, what the sound wave actually is doing is it's compressing and expanding out the cells. So you're actually squeezing the cells a little bit, and you're mimicking a new injury to make your body think that you're getting injured when you're actually creating no damage at all to the body. You're tricking the body into having a stronger response, stronger healing response.
So what kind of conditions and injuries are we using this for?
All sorts of different things. In my end of things, I'm working with orthopedic injuries, so it's knee problems, shoulder problems, hands, wrists, ankles, arthritis, things like plantar fasciitis, tendinitis, bursitis, all those chronic aches and pains that we have that just don't want to go ahead and get better.
What about things like wounds, burns, things like that?
It's being used tremendously to reduce down and the inflammation associated with new injuries. And actually, it does tissue regeneration. It forces your body to make new tissue. It's not just healing it up with a scar. You're actually forming new tissue all over again. You can actually replace what's been damaged and lost. Not only just for wounds like that, for the soft tissues, but also for the nerves too. It's patented and FDA approved for soft tissue regeneration and for nerve cell regeneration.
This is kind of amazing to me. Now, what makes it more effective than like a shock wave type therapy?
The shockwave therapy is it's an older technology than what we have now. Okay, shockwave therapy is designed to go ahead and create some tissue damage to stimulate your body to start healing up again. Okay, it's you heard it to make it get better again. What this is doing, it's basically stimulating your body to have just a positive reaction as opposed to damaging it and then trying to heal up. You're actually tricking the body into thinking that there's an injury when there isn't, and you force a stronger healing response.
Okay, the elephant in the room. Mm-hmm. Does it hurt?
It doesn't hurt on normal tissue. We're using a little bit of soreness to go ahead and actually find out where the injury is. It's a very diagnostic type of therapy where I can actually find out specifically where the damage is and where it's not. So I can treat the damage more effectively and quickly it actually reacts to the damaged tissue and creates a little bit of soreness. Okay? Not bad. We can go ahead and control that.
How long does it take, for this to happen? Does it happen immediately? How many sessions would you have to go through?
Most of our patients, about 90% of our patients, show a significant improvement with the first visit. Okay, that we actually can get a change in pain and a change in flexibility after the first visit. And the visits, it takes maybe about 15 minutes of treatment to go ahead and create those kind of changes. And those changes, after the first visit will last for anywhere between a few hours and a few days. But it's an accumulative type process, like working out and dieting and things like that. It's basically after about, anywhere between, 1 and, 12 visits, we can go ahead and get the condition more under control and have a really strong response. We have about a 91% response rate.
Wow.
As far as getting people to go ahead and get back to normal activity.
Is it covered by insurance, Medicaid, Medicare?
Unfortunately, not right now. Okay, any stem cell type of treatment that this is considered is not covered by insurance right now. But we try to keep the costs very, very competitive and easy to go ahead and live with. We have actually a low-fee diagnostic, initial visit just to see whether we can help. And if we can, that's great. We'll go ahead and move from there. If not, then this isn't the right thing for you.
I don't want to put you on the spot here,
Sure.
but is it safe?
Extremely safe. It actually creates no damage on your body. You can use it on almost every part of your body. It's the safest thing you can go ahead and do as far as any type of therapy I've ever seen. The worst you're ever going to get out of it, the FDA says the side effects are negligible. You're getting maybe a little tenderness and maybe a little bit of redness in the tissue temporarily, and that's it.
So that's it for side effects?
That's it for side effects.
Because, when we talk medication now, there's a whole list of things, disclaimers for everything going on. All right, so who would be a candidate?
Well, as far as what I'm dealing with, anybody that's got a, acute condition that's not improving as quick as they want to, if they want to speed up the healing rate to go ahead and get back to their activities better and faster, their sports or whatever, and people with chronic pain conditions that just aren't getting better, people with arthritic conditions. I see a lot of people with bone-on-bone knees, bone-on-bone hips, people post-surgery that they're not healing up well enough or quick enough, they don't want to get back to their normal activities faster. It's basically anybody who's got chronic or acute joint pain, muscle pain, tendon pain, bursitis, tendinitis, things like that, is what I deal with.
We only have a minute left, but I want to mention the fact that you said certain NFL teams are using this.
Yeah, a lot of NFL teams, Major League Baseball teams, NBA teams, a lot of hospitals like Mayo Clinic is using it, Cleveland Clinic is using it. It's very well received by a lot of different professional organizations.
Dr. Gefaller, it sounds fantastic. Thank you for joining us. I really appreciate it. For more information and answers to your questions, contact SoftWave Buffalo by calling 716-667-6800 or go to softwavebuffalo.com. Sponsorship and promotional consideration for the preceding segment was provided by SoftWave Buffalo. And don't forget to join me weekday mornings, 7 to 9 on The Big Weck.
Thanks for watching this edition of The Big Weck Presents Buffalo on the Rise. For information on this and other shows, go to our website, bigweck.com, and find out how you can participate on the program if you're a hometown business. I'm Joe Chili. Thanks for watching and listening to The Big Weck, Buffalo's oldie station.
The Big Weck Presents Buffalo on the Rise was sponsored by Dr. Kaplansky Dental Implants. Get new permanent teeth in 24 hours with our exclusive Teeth Now process.